What if I told you that the first signs of throat cancer are so subtle, most people ignore them until it's too late? Stick around because by the end of this video, you'll know the early symptoms to watch out for, before it's too late. Let's start by understanding what throat cancer really is. Throat cancer refers to cancerous growths that develop in the throat, voice box, or tonsils. These areas play vital roles in your ability to speak, swallow, and even breathe, making the disease especially impactful. The most common types include pharyngeal cancer, which affects the upper throat, and laryngeal cancer, which targets the voice box. One of the biggest challenges with throat cancer is that its symptoms can mimic everyday ailments, like a sore throat or a hoarse voice, which often delays diagnosis. What's more concerning is that some throat cancers can develop silently, without causing any pain in the early stages. That's why understanding the early signs and risk factors is crucial. Not just for you but for the people you care about. Let's take a moment to focus on the whispers our bodies sometimes give us, the subtle signs we tend to overlook or dismiss as insignificant. Throat cancer doesn't typically shout in its early stages. It speaks softly, hoping we'll pay attention. The first of these whispers is often a persistent sore throat. Now, sore throats are common. We all experience them from time to time, usually linked to a cold, allergies, or even yelling too much. But a sore throat that doesn't improve after 2 weeks, even with rest and medication, is a red flag. This isn't the kind of discomfort that fades. It lingers, creating a sense that something isn't quite right. Another early sign is hoarseness or voice changes. If your voice suddenly becomes raspy or sounds different for no apparent reason, and this change persists for weeks, it's a signal worth investigating. Often we blame such changes on overuse or seasonal allergies, but when your voice stays altered, it could indicate something more serious, possibly cancer affecting your vocal cords or the surrounding tissues. Then there's difficulty swallowing, also known as dysphagia. Imagine feeling like food or even liquids are getting stuck in your throat, or that every bite comes with a little pain. You might even find yourself avoiding certain foods because swallowing has become uncomfortable. This symptom often sneaks in gradually, making it easy to dismiss as a temporary problem. But it's one of the most critical signs of throat cancer. Chronic coughing is another symptom that often flies under the radar. While most coughs are harmless and related to colds or allergies, a persistent cough that doesn't go away, or worse, brings up blood, is a warning sign you can't ignore. A dry, nagging cough might seem like a nuisance, but it's your body trying to draw your attention to something happening deep in your throat or lungs. One of the most overlooked symptoms is unexplained weight loss. Losing weight without trying might sound like a dream to some, but when it happens out of nowhere, it's a sign that your body is working overtime to fight an illness. Cancer, including throat cancer, can speed up your metabolism, leading to sudden and significant weight loss. If you notice your clothes feeling looser or the scale dropping rapidly without any effort on your part, it's time to ask why. Other symptoms that might seem minor, but are equally important include ear pain and a lump in the neck. Ear pain, especially if it's one-sided and not linked to an ear infection, could be referred pain from a tumor in your throat. Similarly, a lump in your neck, particularly one that doesn't go away, could be a swollen lymph node, a common sign that the body is fighting an infection or something more sinister. Now you might be thinking, these symptoms don't seem that serious. Everyone gets a sore throat or a cough, and that's true, but the difference lies in persistence and duration. A sore throat from a cold clears up within a week or so. A cough from allergies tends to come and go. But when these symptoms linger for more than 2 weeks or come with other warning signs like difficulty swallowing or unexplained weight loss, it's time to listen to your body and act. It's natural to hope that these symptoms are nothing serious. Many of us delay seeking help thinking, it's probably nothing. I'll wait a bit longer. But the harsh truth is that early detection is the key to beating throat cancer. When caught early, treatment is often simpler, less invasive, and far more successful. Ignoring these signs, however, can lead to a delayed diagnosis, when the cancer has advanced and become harder to treat. If you or someone you know has been experiencing any of these symptoms, don't wait. Make that doctor's appointment. It's not just about peace of mind, it could be about saving your life. And if you're ever in doubt, remember this. It's always better to overreact to a symptom that turns out to be nothing than to ignore one that turns out to be everything. So, when should you be concerned enough to see a doctor? The general rule is simple. If any of the symptoms we've discussed, persistent sore throat, voice changes, difficulty swallowing, chronic cough, or unexplained weight loss, lasts for more than 2 weeks, it's time to get checked out. It's better to be cautious than regretful. A quick visit to your doctor could involve something as simple as a throat exam or imaging tests like an X-ray or CT scan. In some cases, your doctor might recommend a biopsy, where a small sample of tissue is taken to rule out or confirm cancer. Don't let fear hold you back. Early diagnosis can mean the difference between a simple treatment plan and a more complex, life-altering one. And remember, catching throat cancer in its early stages often leads to much better outcomes. So listen to your body and don't ignore the signs. It's always better to be safe than sorry. Now that we've covered the symptoms and risk factors of throat cancer, let's shift our focus to something just as important: prevention. The great news is that while throat cancer can be life-threatening, there are practical steps you can take to significantly lower your risk. Prevention starts with understanding your habits, your environment, and the choices you make every day. First and foremost, if you're a smoker, it's time to quit. Tobacco use is one of the leading causes of throat cancer, responsible for a large percentage of cases worldwide. When you smoke, the harmful chemicals in tobacco irritate the cells in your throat, damaging their DNA and increasing the likelihood of cancerous changes. But here's the hope. No matter how long you've been smoking, quitting now can dramatically lower your risk. Within just a few years of stopping, your body starts to repair itself, reducing the damage and lowering the chances of cancer. Next, let's talk about alcohol. While it's fine to enjoy an occasional drink, excessive alcohol consumption is a major risk factor for throat cancer. Alcohol irritates and inflames the lining of your throat, and when combined with smoking, the risks skyrocket. If you're someone who enjoys a drink regularly, try to limit your intake. Moderation is key, and cutting back even a little can make a big difference. Another powerful yet often overlooked prevention strategy is vaccination against HPV, the human papillomavirus. HPV is a common virus that's linked not only to cervical cancer, but also to a growing number of throat cancer cases. Getting vaccinated is a simple, safe, and highly effective way to protect yourself from one of the fastest-growing causes of throat cancer. If you haven't been vaccinated, it's worth discussing with your healthcare provider. Diet also plays a critical role in cancer prevention. Think of your meals as opportunities to fuel your body with the nutrients it needs to fight off harmful changes at the cellular level. Fruits and vegetables are particularly important because they're packed with antioxidants, natural compounds that help your body combat free radicals, which can damage your cells and lead to cancer. Incorporate colorful produce like berries, leafy greens, and citrus fruits into your diet. These foods not only support your overall health, but also create an environment in your body that's less conducive to cancer. If you suffer from acid reflux, also known as GERD, take it seriously. Chronic acid reflux exposes the lining of your throat to stomach acid, which can cause long-term damage and increase your risk of throat cancer. Managing reflux can be as simple as making a few lifestyle changes, such as eating smaller meals, avoiding lying down immediately after eating, and steering clear of trigger foods like spicy or fatty dishes. In more severe cases, medication or medical advice might be necessary, so don't hesitate to seek help if needed. Finally, think about how you use and protect your voice. Avoid straining it unnecessarily, whether it's through shouting, prolonged talking, or singing without proper technique. Long-term strain on your vocal cords can make them more vulnerable to damage. Additionally, limit your exposure to environmental pollutants, such as smoke, industrial fumes, and even household irritants like strong cleaning chemicals. These irritants can inflame your throat and weaken its natural defenses over time. Prevention is about consistency and commitment. These may seem like small changes: quitting smoking, moderating alcohol, eating a balanced diet, managing acid reflux, and protecting your voice, but together, they create a powerful shield against throat cancer. Taking action now isn't just about avoiding a disease. It's about embracing a healthier, more vibrant life. Prevention is always better than cure, and by making these adjustments today, you're giving yourself the best chance at a long, healthy future. It's a gift you owe to yourself and the people who care about you. Have you, or someone you know, experienced these symptoms? Share your story in the comments below. We'd love to hear from you. Throat cancer may be serious, but it's not unbeatable. The key is awareness, knowing the signs, understanding the risks, and taking proactive steps to protect your health. You now have the tools to make informed decisions for yourself and your loved ones. Don't let fear or ignorance rob you of the chance to act early. If this video resonated with you, share it with someone you care about. Your small act of sharing could save a life. And if you want more health tips like this, subscribe to the channel. Together, let's make health a priority. Because you and your loved ones deserve a long, healthy life.